Hello, everybody. Welcome today. I hope everyone's having a great day today. Thanks for those that are tuning in live here. And also thanks for those that continue to support us and watch these on our social media platform. I know that this is something that a lot of people have been enjoying and been going back and watching these as we record them and put them out there for everybody to watch. I think, looking at when we started this back in early April, just the individuals that we've been able to have come on here with us, bringing information just about recovery and how people can stay connected during this time has been such a huge tool for those in recovery and also those that work in this field to just bring some education around how things are operating and going during this time of isolation and how people can continue to be supported. So my name is Wes Van Epps. I am an outreach specialist here at Wisconsin Voices for Recovery. And actually, I am joined here by a couple members from our team today. So as usual, we do have Jessica, who is also an outreach specialist here with us. And then Mary and Montee, who are our guests today. They also are a part of our team here, which we'll get into in just a minute. So for those that are tuning in, feel free to type in the chat questions that you have. We will have some time at the end here if you do have any additional questions for our two guests today. But like I said, we appreciate you guys and the support you continue to give us. So like I said, we have two people from our team that are going to be talking today on a really awesome grant opportunity that we've received here at Wisconsin Voices for Recovery. And some also, some great other topics too that we're going to be bringing today. Like I mentioned, Montee is on here with us today. I know that he has been a guest with us in the past, but that was actually before he started working with us. So I know as far as him joining our team, which he's going to get into a little bit about the work that he's now doing, but he's been, of course, before joining our team, working on some great things that he talked about in our previous Q&A, but also we're bringing on Mary Henningfield, who is our principal investigator here for the Wisconsin Voices for Recovery, the ED2 recovery, and the Engagement to Recovery projects. So welcome to both of you. I think just to start us out here, we're gonna dive right in, and I'm gonna be bringing Mary on here first. So Mary, if you want to just give us a little bit of background of the work that you've done in the past and some things that have led up to your position here with Wisconsin Voices for Recovery. And then we'll get right into, if you want to talk a little bit about the OD2A grant that Wisconsin Voices received from DHS.
Yep, I'd be happy to. So can everyone hear me okay? Is that?
Yeah, you're great.
Okay, great. Yeah, so as Wes said, my name is Mary Henningfield. I am the principal investigator for Wisconsin Voices for Recovery and the ED2 recovery program, as well as our new Engagement to Recovery grant, which we'll talk about in a minute, which is also part of the Overdose to Action Community Prevention Grant. So I'm an associate director of the WREN, which is the Wisconsin Research and Education Network, which is in the Family Medicine and Community Health here at UW. And that's where I started at UW in 2018. And that was prior to the responsibilities with Voices to Recovery. But prior to that, I had spent most of my career as a PhD researcher. I worked in, for pharmaceutical industry for different companies, but also had spent some time in patient advocacy. And that's really a passion of mine. I have been interested in healthcare disparities for a long time. And one of the, I have done a lot of work in oncology, and one of the areas I worked extensively in was lung cancer. And with lung cancer, it's also a group where there's a lot of stigma, like in a different way, but really where, a lot of nihilism, where people felt like even their physicians weren't interested in helping them, and just a lot of stigma, mainly related, to smoking. And so I'm really interested in, helping populations that we, are basically underserved, and really what can we do to kind of, close the gap on healthcare disparities. And that's where the grant, the Engagement to Recovery grant. So and probably should preface it because this grant actually was written before all of the COVID pandemic happened. So really, but since the COVID, we were given the award. And so we have to change up a little bit how we approach the grant. But essentially the grant is, to address some of the disparities within the, communities of color. And because we recognize that there are just a lot of deficiencies, and part of the grant was really to have listening sessions and really work with community leaders and do a lot of in-person and phone call and really get input into what the community needs. Because I think sometimes when we write these grants, there's sort of the typical approach is the researchers have an idea and they say, let's go do this, and there might not be as much community engagement or really working with the stakeholders, like the people that will be served or coming into their communities. So sometimes, like that philosophy has changed. So this grant was really to have a lot of listening sessions, find out, what information do they need, what kind of services do they need, how can we better support them. And so we hope to still do that, but and then with Montee's help, but it will be in a different way. It'll be, virtually, like through, platforms like Zoom and maybe phone calls. And, maybe when things open up, we don't know if or when that will happen, but maybe some, kind of in person, later on, because the grant does run for 2 years. So it will end in August of 2022. I mean, it's not a huge grant, like a huge amount of money, but it fortunately, it was enough that we were able to hire Montee on as a research specialist with voices, and that really adds to our program. But a couple of objectives of the grant were to really develop a specific campaign we call it an anti-stigma campaign, but it's still it's very heartbreaking, like across the recovery community, and like working with people on the outside that will say things, still say things like, hey, if you have a problem with addiction, just stop. Like they don't really understand that people need help, that it is an addiction, or like a lot of, like I said, nihilism, or people just don't care about the community. They don't seem to, like if it doesn't affect them, it's just really, and that's really heartbreaking because of, the risk for, I mean, it's really serious, like it's life-threatening, and opioid overdose obviously is life-threatening, but also, like the, sort of the loss of, relationships, homelessness, or insecurity with jobs, like it just can affect every area of your life. And so hopefully if we can do an anti-stigma campaign, it will help people outside the community, but also within the communities. We want people to know that recovery is possible, like to show them sort of the faces of recovery, that, there are things that can help, the medication assisted treatment, some of the behavioral therapy, that there can be a life of recovery. And that's really an important message. And so that's part of the grant. And also we have funding in the grant to help train people of color to be a peer support provider. So that's also very important, because if you're going to get help from someone and it's you're kind of, bearing your soul about if you have a problem with opioid use disorder, it's really important that you are talking to a peer, someone who has, walked in your shoes, and hopefully someone, from your community that can help you, navigate and talk about what's possible in terms of recovery, but also like maybe shared experiences to what they faced, throughout their pathway to recovery. So we hope that we'll be able to identify some people, get them training. And also, if they are trained, hopefully it will be also help, maybe they can be rolled into our other grant, the ED2 recovery program, where some of the coaches can get paid. And so that can be like, sort of an economic, benefit as well. So those are the main, aspects of the grant, really community outreach, trying to get more representation from communities of color and, working on the anti-stigma campaign. So I'll stop there because I do want to ask Montee to, and we're so glad, we're really fortunate to have him on our team and have him talk a little bit about, his experience, I guess, because now he's a trained coach. So we're very excited about that and sort of what we hope for the future.
Great.
Yes.
Thanks, Mary.
Oh, did I lose you, Montee? Do you want to say a few words?
Go ahead, Montee.
Yeah, I do. I appreciate that, Mary. For one, I'm most definitely, obviously, extremely excited about the opportunity, hopping on board with Voices for Recovery, all the above, because I just think that it's, a wonderful opportunity to really dive into communities and really help out, spread knowledge, resources, all of the above. I'm most definitely really thrilled about how, we have the funding to, really get, people of color, to get them to become recovery coaches, to get them to become peer support specialists. I think that's awesome because I think there's a lot of power in, obviously sharing your stories, but being able to share relatable stories. For me, getting into therapy, getting into counseling or whatever, whenever I started my recovery journey, I most definitely wanted to choose somebody who understood, my background, understood what it was like to be a person of color and all the above. So my goals are not only to connect to these community leaders in these marginalized populations, but it's really to be a voice to scream and shout as loud as I can on top of a hill to everybody who, everyone who's a person of color who wants to help, providing them with the knowledge like, hey, we can help you out to become a recovery coach, a peer support specialist, and you can spread that knowledge to others in your community and all the above. So it's exciting times. Again, I'm new to Wisconsin Voices for Recovery, been learning a lot, but it's exciting times because it's, this is an awesome opportunity in my recovery process and my recovery journey. Now it's time for me to really, really give back to those who, may not, understand some of the resources they have available to them.
Yeah, thanks for touching on that, Montee, and I'm going to be coming back to you in a minute here too. I would like to ask though, Mary, quick, if you could just talk. I know that you've been a part of a lot of different programs, even outside of your involvement here with us. So looking at, some of those other programs and the approaches that have been taken within those programs, how does this differ? How does this differ from those other grants and the other programs that you've been a part of? How does this grant differ from those?
Yeah, thanks for that question. Yeah, so that's what I was saying a little bit before, where, a lot of times, there's a, funding opportunity and it's, maybe the researchers, like I'm in a, position of privilege basically to, apply for these grants. And a lot of times, there's sort of a preconceived idea of what the community needs without really, asking people and really, formulating the ideas for the program together. And so, and I think there is more of that, like sort of, nationwide, because there is a push to really have, stakeholder involvement. And so like, even in writing this grant, we kind of put in some ideas like, well, maybe we want to do podcasts or maybe, I don't use social media or whatever, like, but those are just ideas. Like if the community says, we're never going to listen to podcasts, like our community, we don't have, some places in the state don't even have access to Wi-Fi that's reliable. So maybe, we want the community to tell us what their needs are, like how we can best help them. And like, especially in terms of the, anti-stigma campaign. And maybe it's, maybe it doesn't turn out to be a campaign. Maybe it's more of, some kind of communication where it's a, a one-on-one where like Montee said, where, there is a peer that's, within your community who can reach out, more of a one-on-one, trying to face the barriers of like getting into treatment or even, like behavioral therapy. Like it's scary. Like if you've never been to, therapy and you're going, to this clinic that you don't, you don't have any connections with, and it's a person of another race is your provider. And like, I mean, there have been studies that show that, yes, if it's someone from your community, you know, someone of your same color, that does make a difference in your trust and, you know, the sort of success. So I think to me, the main way that it differs is really that this was intended to be a stakeholder involvement from the beginning where, you know, yes, we have ideas of things we could do to help, but a lot of programs have failed and we don't want to come in with, say, hey, here's what we're going to do for your community. We want, you know, community engagement from the leadership. We want to talk to people, tell them what their needs are, and really try to adjust our programs and, you know, to maximize the services that we can offer.
Yeah, and I guess going back to Montee here, I know that you've recently gone through the coach training, so now you are a trained coach here. So maybe just talk a little bit, if you could, about how that experience was for you going through that training, because I know for myself, I also can train that course that you went through, so I know that the different, of course, exercises and workshops throughout that training can be pretty impactful, especially with those that are in the training that have possibly gone through some traumatic events in their lives, or even just your recovery process as a whole. So just talk a little bit about maybe your experience with that training. And I know that you mentioned specifically the importance of being able to offer now your service as a coach to those people that are of color. So I just want to maybe just talk a little bit more about your experience there and how important you feel it would be for those individuals to get trained.
Yeah, awesome question. So the recovery coach training was it's quite thorough. You most definitely get a good amount of information, really good amount of information thrown at you. We were fortunate enough to have some really good teachers for the course to really walk us through the steps, walk us through the book that we have, and really to get us to engage in throughout the course. So it was an awesome opportunity to obviously learn a lot, learning about different types of individuals, learning about how to address certain questions, learning about how to identify if one is dealing with a crisis or not. Very, very valuable information that is obviously going to allow for me to be the best recovery coach I can be. So I'm extremely thankful that I was a part of that course. Now for me, it's almost I feel as if it's a duty of mine now to share that information, but to also focus on how I have to build that trust within these communities. I harp on that so much, but we tend to see, like we say, the racial disparities with education, income, et cetera, and obviously throughout the healthcare sector as well. So for me, I just want to make sure that when I'm diving into these communities, I'm not only just talking about my experiences, what I've done, how I went from rock bottom and now to a place to where I want to share my experiences. I also want to focus on building that trust within these communities, because that's just huge. And that's something that we learned in the course as well, how important it is to express or to have empathy, compassion, and to understand that, everybody comes from different walks of life. So there's just so much knowledge now that I have that I can't wait to really start utilizing. I mean, we can even talk about, individuals not even understanding if they're eligible for CCS programs or I mean, it's just a full wraparound service that I'm most definitely ready to kind of instill these communities with.
Thanks for that, Montee. And I know you brought up a topic of racial disparities, which is kind of the next thing that I want to talk about here. I guess this question for both of you, whoever wants to start, maybe Mary, if you want to start, but I guess, how do you feel Wisconsin is doing in terms of the racial disparities within the opioid epidemic?
Yeah, I can start. Well, actually, unfortunately, within Wisconsin, the news is not good. So, there's a lot of different numbers I could throw at you, but for example, Milwaukee, which is Wisconsin's largest city, it has been named the most highly segregated city in the nation. I think that's been true for more than 1 year. And yeah, so there's that. And there's also like really I guess it's just really a significant healthcare problem and things. I think I want to talk a little bit about present day too, because it feels like things are getting, a little bit worse because of COVID. But actually, if you look at the rate of death among African Americans due to opioid overdose, like in Dane County alone, it's almost twice as high as for Caucasian people, and that's really like devastating, and like there's different reasons for that. Like if someone is in an overdose situation, there's more fear of calling in the police or calling 911. So there's all of those, like, and we really need to think more about trauma informed care and what the experiences are. But really to hear that number that the death rate for opioid overdose is twice as high. And this has been going on for a very long time. And I also want to kind of say too, and this is, I don't know, sometimes I think when we talk about this subject, we do have to have like very difficult discussions, but I know when we think about the opioid epidemic, like there really was a tragic rise in African-American populations. I think I want to say it was ignored, but maybe not true all the way across, but I think really a lot of the visibility with like media and so forth didn't really happen until some of the opioid issues became more prevalent among basically white suburban, communities. And then it got a lot of attention, or white rural communities. So I feel like that was also something that created a lot of mistrust among communities of color, because, it had been, opioids were, an important cause of death, and like it was kind of ignored until, it hit another community. And then all of a sudden it got a lot more attention, and even now there's, disparities in terms of, like not getting the resources to the communities that really need it. And there also is like, again, a comment, like, often, like I said, some of these discussions can be very difficult, but there was, sort of a time when there was this focus on war on drugs, and it really was sort of a policing effort among African-American communities. And that also added to a lot of the mistrust. African-Americans are more likely to be arrested for, like drug possession and drug-related charges. So that's still ongoing. It's interesting now because with obviously the media attention the last, since COVID started, but also Black Lives Matter, and maybe there's more awareness, but that's also, like, to me, it's a little bit heartbreaking too, because I feel like these issues have been going on for, a very long time. It's systemic. It's been going on for, centuries, kind of like within our system. And so things need to change. And kind of one last comment just about Wisconsin in particular, and this isn't necessarily always directly related to opioid use disorder, but I lived away from Wisconsin for a long time, even though I grew up here. And when I came back, it was more obvious, like the drinking culture of Wisconsin, and sometimes we're ranked #1 in terms of like heaviest drinking and most binge drinking. And sometimes I hear people like point to that as a source of pride in Wisconsin, and it's so it's a really big problem. But until we change sort of the paradigm or the culture, I think it's it's going to continue as a problem. So something I don't know if it's unique to Wisconsin, but certainly one of the bigger problems in Wisconsin.
Yeah, thanks for that, Mary. And I also too want to hear a little bit from you, Montee, on this subject. We do have a few minutes left here, but is there anything that you'd want to add to this?
First, I want to say, Mary, that's as a Black man, it's awesome, seeing obviously people from different backgrounds noticing that, mentioning it, and saying it, because that is, those are tough conversations to have. But I'm so glad that we are at a time now where we're starting to have those conversations, because we're going against a beast that's been alive and well for a very long time. We all understand that. And it's not an overnight thing where we can just jump into these communities and expect for them to trust us, because we're expecting for them to trust, I'm just going to say, white people, who have, just like you said, the war on drugs, the generational damage that has been caused, individuals who are afraid to reach out to help because they may be afraid that they're breaking the law and their father is in prison for 25 years for whatever it may be. So it's just that trust that we got to continuously harp on and continuously try to gain from these communities, but it's not going to happen overnight. So I just want to say I love the fact that you brought that up, because just like I'm forgetting his name, but bless his heart for mentioning it as well, where we need time to heal, these individuals to heal, but also throughout that healing process, a time for us to build some trust with them as well. So it's something that, again, you can tell I'm very passionate about. I'm blessed to be a part of this, and I think that we're going to get it done.
Thank you, Montee. And I know that, of course, for me, I work with both of you every day, and it's so I know the ins and outs of all the hard work, even behind the scenes that you guys are putting in, and our team here is putting in, specifically on this grant, but also the other projects and things that we're doing to address these issues and how we can just continue to help people within our communities, because that's really what it's about. Is of course looking at us as individuals that are in recovery, but how can we give back to those people that we do care about, that are seeking the help and are seeking people to lean on during this time. So I'm really glad and fortunate to have you guys here on our team, but also coming on here today. I do want to open it up here. We do have a couple minutes. I know there's a few people on the line here. If you guys have any questions, I'll open it up here for a minute. If not, we will let everybody go. So let's just open this up here for a second. If anybody on the line has any questions for Montee or Mary. If not, that means you guys answered all the questions that we had. We did get a comment from Bev saying, thank you for the work you're both doing. Like I said, I know that we, as far as Jessica and I, appreciate the hard work that you guys are doing. And we're super grateful and happy to have you, Montee, on our team now, with all the amazing work that we know that you're capable of doing with us here in our communities of need. So I just want to again say thank you both for coming on here with us today. And with that being said, we will let you guys go. I hope everybody has a great 4th of July weekend. Please be safe. Stay connected to those individuals that are in your community and in your support group networks. So I know that this, especially the holiday season, can always be a tough time for those in recovery. So making sure that you have those plans set for not only your safety, but also the safety of what's going on in our communities, and making sure that you're staying healthy. So with that, thank you, everybody. Have a good holiday weekend, and we'll be talking to everybody next week, Wednesday. So thank you, Montee and Mary, for coming on today.
Thank you. Thank you.
All right, bye.
Everyone. Thank you.
Thank you, guys.